Hi, my name is Sarah Feldman. I'm the physical therapist at the MDA ALS Center of Hope at Temple University. I'm going to talk to you a little bit right now about ambulatory aids that can assist you with your mobility. So if you're having difficulty with walking or noticing a little change in your balance, the first thing you want to do is talk to your physical therapist at your center or your clinic and ask them about what items might be able to assist you. I'm just going to show you a few of those items right now, just so you have an idea of what they are if the person talks to you about them. So one thing to start with is a cane. So I like canes if somebody's having difficulty with maybe balance outside or on uneven surfaces, because it gives you just that extra point of support and a little bit of that balance point. So this is just a standard single point cane, and this is a little bit of an offset cane, handle cane, and they basically provide the same amount of support and balance assistance. If I'm measuring this for a person, I'm going to see that it falls right at their wrist when they're standing on their side, and then when they reach out, it's a nice comfortable position for them. Using a cane, you want to use it opposite the leg that perhaps you feel is weakest if you have an issue like that. Again, this just gives you that little extra balance if you're outside walking, or maybe in a crowd and you just want a little bit of security. This helps with that. There's also something called a forefoot or a quad cane, and this has a little bit of a foot. It has some little extra feet on the end. This can make it a little bit heavier, so it can be a little harder to walk if you're out walking in public with this. But it does make it nice sometimes if you're going up and down stairs and you need a little extra support, or if there's a specific area you need to walk in and you know that path is clear and you just need that extra support, as well as then you can just set it down and it stays wherever you're going. Occasionally I will talk to people about using two canes, so then you would walk opposite, and this helps your gait pattern because normally our arms swing opposite our legs, and so it can help with that. If you don't want to use canes but you think that kind of support might help you, then you might want to try out walking sticks. They might be a better option or a place for you to start. If this is not quite enough, if you're limiting the amount you're going out because you feel unsafe or unsteady, a rolling walker, so a walker that has wheels, is the next step up that we like to recommend. And the nice thing about this is that it gives you that extra support and safety, but you can still get a little bit of your normal gait pattern with this. These are the ones that you've probably seen are readily available, and these are the standard rolling walkers. They fold up so they can travel with you. They become quite small. But a lot of people these days are using what we call a rollator. A rollator has 4 wheels versus just the 2 wheels. It has brakes and it has a seat on it, so that if you get tired, you can then stop where you are and take a rest. So I do like rollators. I find them to really increase the independence and safety for a lot of the people I work with, and we can try them right in the clinic and see if they like them. They are a little bit bigger than the other ones, but they also do fold up so you can take them with you. And again, I like the feature that it has a seat, so that if you're out traveling somewhere, say you've gone to, maybe you went to the art museum and you want to sit somewhere for a little while and look at that particular room, you have that right with you. So again, these are just a few of the items that we start with as mobility aids for ambulation. There's canes, rolling walkers, and rollators. So when I'm talking with people in the clinic, when I see them and we're talking about difficulty, they might be having walking or going distances, then it's time to approach the idea of using a wheelchair, which I know is difficult for a lot of people to think about. So I want to show you what some of those are so it's not at least an unfamiliar area. So this kind of wheelchair, this is called a transport wheelchair or a companion wheelchair. And these are nice light wheelchairs that are easy to carry, easy to put in and out of cars. They fold up and they can be lifted up and in fairly easily. They are usually made of one solid piece of material so the armrests don't come off, the backrests don't come off, but you can usually swing away the foot plates to make it easier to get in and out of the chair. These chairs are great if you're going like to the mall or to a hospital or to visit doctors, because the 4 small wheels roll very easily on nice level surfaces. If you're going out to, say, a soccer game or across an uneven path or out in along a trail, then you might want to consider more of a standard wheelchair with the larger back wheels. These kind of wheelchairs are much easier to get up and over curbs, to go over uneven surfaces, and they're much more comfortable to sit in those instances. However, they are a little heavier. The larger back wheels make the whole chair a little heavier, and you can see they're also a little larger than the transport chair. So you do have to think about that when you're transporting them. They often have removable armrests and also the removable leg rests or foot plates. So that does make it a little smaller and easier to put in and out of a car, but it's still, like I said, a little bit larger than a transport chair. So these are the 2 types of manual wheelchairs that you'll commonly be seeing or commonly be using. There's another type of manual wheelchair that I just like to show you, and that's a high back reclining manual wheelchair. And these are made for situations where you might need a little bit more support, or perhaps it's harder for you to sit upright, because the backs on these wheelchairs do recline. They're higher, so they give you better support. You can get, these are called leg rests rather than just the foot rests, and they offer much better support for your legs. Now, what you want to look for in any of these chairs is that when you're sitting in them, you know, you want it to be comfortable. You don't want to get a chair that's either too wide for you so that you can't get your arms around the outside if you do want to change your position and can still do that. And you don't want to get a chair that's too narrow for you so that you're getting squished when you're sitting in it and it's uncomfortable. These chairs are often just used for going places, so you usually just have to get a cushion, just an over-the-counter cushion, something you can get online or from your clinic, just to make it comfortable. We don't usually recommend specialty cushions just for these kind of chairs. So again, this is a transport or companion chair, a standard manual wheelchair, and a high back recliner wheelchair. So if you are starting to use a wheelchair and you're using it occasionally when you go out, or if you're going to your kids' sports teams, games, or something along those lines, then you might just need a regular cushion that you can just buy online. That's just a nice foam and it's just something that makes you comfortable while you're sitting. That's the first level of cushion. The next level would be maybe something that's a little, we say contoured. It's a little more shaped so that you have a little bit better positioning. Now, can you see that there? This is a little bit of contouring there. So that gives the person who's sitting in it just a little bit more better, like I said, better positioning for where they're sitting. Then the next 2 are actual pressure relieving cushions. This is a gel cushion, so it has gel inside. This particular brand is J. There are other brands, but this is a well-known brand. And this has a positioning foam underneath and then this gel in the back, so that when you're sitting on it, your areas, your bony areas in your butt are getting nice pressure relief in that area, but again, it's positioning so it helps you with that. And then the next cushion is called a RoHo cushion. The RoHo cushion is air-filled bladders. So there are air-filled bladders inside of this. Let me see here if I can unzip it and show that to you for a minute. And each of these are filled with air so that when you sit on it, it should feel like you're sitting on air. So to properly inflate a RoHo cushion, when the person's sitting on it, you don't want to pump the air up so much that it feels like you're sitting on rocks. You want to pump it up and then start to let some of the air out so that those air-filled bladders actually conform to your body so you feel like you're sitting in the air. And so that gives you a lot of great pressure relief from the cushion itself. So those are some of the basics for cushions. There's just plain pieces of foam, something soft and squishy that you can use if you just need it for a little bit. There are cushions that are a little bit more conforming and give you a little better support. And then there's the higher end ones, which you can learn more about online. One is called the J cushion and one is called RoHo cushion, R-O-H-O. And I want to talk to you a little bit today about the difference between a manual and an electric patient lift, or you often call it Hoyer lift, though Hoyer is a brand name. There are many similarities between the two devices, but there is one big difference, and that is that the electric one is run by electric, and you can just push a button and it goes up and down, and the manual is hydraulic. So first, let's start with the slings. This is a full body mesh sling. So if you can see through it. This is used often for getting showers, or if somebody has to sit on the sling all day. And this is a U-sling, and it goes behind the person's back, and then these straps come under their legs. And I'll just show you, again, one of the similarities. Both of these devices have the hooks that you can put the slings on. And you sling it across this way, because if you put it the other way, these things will bop you in the head. And then each of these go on the side. And then these pieces will go underneath the person's leg and come up the other side and attach. And the same thing here, will go across, and then the person will be sitting in here, and that's how you're going to lift them up and down. Again, this is similar hooking. The hooks are very similar on each of them. The base is also similar on each of them in that it's a regular size, and you can make it wider to make it more stable, or narrower for getting in a narrow spot or for storage. The same thing here. There's a handle on, I don't know if you can see this, so let me turn this around for you. There's a handle on the back that switches the legs either narrow or wide. They're a little bit different in size. They both have handles in the back to help you move the device. Here's my handles. And then the manual one is just that. You manually pump it. Can you see the arm here going up? To get the person raised up in the sling, to get them up off whatever it is you are trying to take them up off of. And then the power one is simply the push of a button. You see that raises the arm up, or has it come down. So these are both great devices. Many people feel, of course, that the electric one is easier to use for the caregiver. It certainly is easier to lift somebody up and down just by the push of the button. These are a little bit lighter, so maybe depending on where you are, if you have to move it a lot of different places, this might be a better choice for you. You do need to keep this one charged in order to be able to use it, but they are, in general, both really great pieces of equipment to help you transfer your loved one from one place to another.